Hi everyone, it's Dr. Gambhir. Wanted to talk to you today a little bit about how we prepare Botox in the office. So a little bit of a Botox unpacking or unboxing video as well. When we get Botox in the office, it comes to us on dry ice. So really it comes to us very cold. And once it comes to the office, directly transferred to the fridge. And our fridges have temperature monitors attached to them with Wi-Fi signals if those temperatures should get out of range to the key staff member. So we really pride ourselves on keeping that Botox at the right temperature. Once we pull that Botox vial, it looks very similar to this or exactly like this. And I've partially opened this package, but then we are opening the Botox vial. There's a package insert here with lots of information by the manufacturer, given the details of the product, and this comes with most medications from the pharmaceuticals. This is how the Botox vial looks. So it's an easy to open package with housing inside, and we'll show you some close-ups, but Botox really has nothing in it. It almost looks like the first time I saw Botox vials 20 plus years ago, they look like empty vials. When you look closer, there's a little bit of white film at the bottom, and that white film is actually equivalent to 100 units of Botox. So we cannot inject that film into our patients. So what we do is we take off the cap and we use sterile saline, and that is going into the top here, and that is then taking those 100 units of Botox, almost think of them as little crystals, and then diluting or actually spreading that 100 units of Botox into that liquid. So now we have the 100 units in a liquid, and we can really then inject that dose appropriately into patients, because liquid is injectable and this dry film clearly is not injectable for patients. So different practices have slightly different styles of preparing their Botox, but the only real difference is how much liquid you're adding to this 100 units of Botox. Some practices will add 2 cc's or 2 milliliters of solution. Some practices will add 2.5, some 3, some less. But no matter how much volume you're adding, in that volume is still 100 units of Botox. So when we're dosing patients, we're not dosing based on the volume. We're dosing based on the number of units. And that's what creates consistency between practices, because the Botox has been prepared a little bit differently. The number of units becomes consistent from practice to practice. So 20 units at our practice would be consistent with 20 units at a different practice. And I think that's pretty key to understand. There is artistry, not only the injection of Botox, but there's a belief system in the preparation of Botox, different volumes spread differently. So we have our own ideology of how much to put in there and how that Botox then spreads, giving a better result in our opinion. Some practices may do things differently. But again, it's really based on the number of units. The process of preparing Botox, the process of injecting it, is treated with the utmost care and precision in our office. And you'll be seeing along the way some videos of how we prepare that. From in the morning each day, we prepare probably somewhere in the neighborhood of 30 vials of Botox plus per day between the offices, and maybe even more than that. Always happy to answer any questions, but wanted to give you guys a little bit of a sneak preview behind the scenes of how we do this. Thanks.